So, hello everyone. Myself, Dr. Sandeep Dahilekar, Professor in Rog Nidan Department. Today, we have our Saturday pedagogy session related 59th session, and this 59th session resource person is Dr. Anu Vijayan. She is the assistant professor in the Department of Shalakya Tantra, Parul Institute of Ayurveda. Dr. Anu Vijayan has completed her undergraduate at Shantigiri Ayurveda Medical College, Palakkad, Kerala in 2012 and completed her master degree in Shalakya Tantra from Parul Institute of Ayurveda, Gujarat in 2022. Currently, she is working as assistant professor in Shalakya Tantra department at Parul Institute of Ayurveda, Parul University, Limla, Vadodara, Gujarat. She had clinical experience in Shalakya Tantra from Sri Dhariyam Ayurveda Eye Hospital, Pothattukulam, Kerala from 2013 to 2015. She secured first rank in Shalakya Tantra and second position from Parul University in her PG studies. She has four journals which she published in Web of Science and Scopus Index, and one book she published on her account. So this is all about Dr. Anu Madam. Madam, the session is your. You can please proceed.
Okay, sir. Thank you for inviting me to do a pedagogy section. Uh, Today my topic is ENT diseases associated with COPD and its management. Is it visible, sir?
Yes, ma'am. It is visible.
Okay. Today's my topic is relation of ENT diseases with COPD and its management. First, we are moving to the introduction. COPD is the second most common lung disorder in India. It is frequently seen in middle-aged people above the age of 35. Most affected gender is male because cigarette smoking is the main or the leading cause for COPD. COPD is the main cause of chronic morbidity and mortality among the patient above 55 years of age. It is equally prevalent in urban and rural areas. COPD is defined as the progressive development of chronic airflow limitations which is not fully reversible, and it is include chronic bronchitis, emphysema, and small airway diseases. It is more prevalent in men, but the more death rate comes from female gender. Mm, Men are commonly more affected, but the females are more uh, affected. And chronic bronchitis is the chronic cough with the expectorations for at least 3 months of year or more than 2 consecutive years. Emphysema is defined as the permanent abnormal distension of the airspace distal to the terminal bronchioles. There is some close relationship between the COPD and ENT diseases. Hearing loss, ear blockage, ear
Madam,
fullness.
your slide is not sliding here. It is not moving.
Okay, sir. It's not moving. Now it's okay, sir.
Okay, okay, okay.
Okay. Chronic bronchitis is the chronic cough with expectorations for at least 3 months of year for more than 2 consecutive years. Emphysema is defined as the permanent abnormal distension of the airspace distal to the terminal bronchioles. There is some close relationship between COPD and ENT diseases. Hearing loss, ear blockage, ear fullness, rhinosinusitis, nasal congestion, nasal ciliary dysfunction, nasal polyps, oropharyngeal dysphagia, pharyngitis are the main conditions occurs in patient with COPD. Next, moving to the disease COPD. Chronic obstructive pulmonary disease is the obstruction of flow of the air through airways and out of the lungs, which is progressive in nature and irreversible. It includes many conditions like emphysema, chronic bronchitis, irreversible asthma, bronchiectasis. What is COPD? In COPD, the inflammation of airways will occur, and there will be the more collection of mucus will be there, and the airway become narrower and limited airflow will be there. In chronic bronchitis also, there is the inflammation of the inflammation and excess mucus secretion in the airways will occur. Next, move to the emphysema. In emphysema, the alveolar membrane breakdown will be there. So there is a dysfunction in the gaseous exchange between the alveolar and the surrounding capillaries. Emphysema means the impaired gas exchange from the destruction of walls of over-distended alveoli. Chronic bronchitis means the inflammation of the bronchioles, excessive accumulation of the mucus, and irreversible asthma. That means in the inflamed or constricted airway obstruct the air. That causes the irreversible asthma. Bronchiectasis means mucus sticks the bronchi, and the infection and the inflammation of the bronchus will occur. That is called as bronchiectasis. This is a COPD picture of the alveola. First one is the normal air sac. In COPD patient, there will be the damage of air sac will occur, and the normal movement of the air will not be there. Or trapped air will be there inside the alveola. There will not be no exchange of gas from means O2 from the alveola to surrounding capillaries will occur. Then moving to the causes and risk factors. Cigarette smoking is the most is a big risk factor or cause. And emphysema. The emphysema patient also having a chance of getting COPD. Chronic bronchitis. The patient with chronic bronchitis also having a chance of getting COPD later. And exposure to smoke. Asthma means chronic asthmatic patients. In those patients, there will be the hyper secretion of the mucus and hyper response of the alveolar walls. That will lead to the COPD. Exposure to smoke, that also cause irritation to the pathway and also hyper secretion and hyper response. Next, occupational exposure to the dust and chemicals also cause irritant to the airway path, and there will be hyper secretion and hyper response. Exposure to fume and burning. Next one cause is genetic, which is inherited through families. That is the deficiency of alpha 1 proteins. Alpha 1 protein means that normally producing protein from liver, which helps in immune response, and which help the airways to destruction, help the airway from the destruction. If it is very less in our bloodstream, then there will be higher rate of destruction of airways. Next, moving to the pathophysiology. Noxious gas exchange inhalation. That means from the cigarette smoking or other toxic gas inhalation, that may lead to the abnormal inflammatory response in airways and parenchyma and pulmonary vasculature. Which will lead to the the normal reaction will be there. The body attempts to repair its chronic inflammation. That leads to the narrowing to the airways, and overtime injury and repair process causes scar tissue formation and permanent narrowing of the airway and lumen. That leads to the parenchymal destruction, that will cause the emphysema. Airflow obstruction resulting in muscular weakness will be there. Increased circulatory inflammatory markers also will be there. And moving to the clinical manifestations. Chronic kapha with sputum is the main clinical manifestation associated with dysphonia, wheezing, chest tightness, frequent respiratory infections, and enlarged alveoli. Advanced symptom cyanosis, there will be less oxygen, so there will be cyanosis will be there. Morning headaches will be there. There is less oxygen supply to the brain also, so there is morning headache will be there. Weight loss will be there. Hemoptysis means blood filled sputum will be there. Swollen feet and ankles will be there. All these are the advanced symptoms. If patient with chronic COPD at their last stages, they will show these types of symptoms. Comorbid, comorbidities. ENT diseases are comes under the comorbidities of COPD. It reminds the doctor the importance of taking accurate medical history. It all includes, there are a lot of symptoms in ear, nose, and throat. I will discuss it later. First one, the ear symptoms. Ear symptoms are comes under the constant syndrome. Constant syndrome means the complex. There are the three symptom complexes will be there. That means the tinnitus, stiffness, and loss of hearing will be there. There is a close relation between TMG joint, temporomandibular joint, and middle ear. The Pintos ligament, which is the connection between the temporomandibular joint and malleus of the middle ear. Uh, there is a ligament there that is called Pintos ligament, which is a cross connection between temporomandibular joint to the middle ear, that is malleus of the middle ear. The patient with chronic COPD, chronic obstructive pulmonary disorder, has abnormal opening of the mouth, which lead to the altered ligament tension, which causes the dysfunction of the middle ear with the risk of hearing loss. Uh, and the abnormal mouth opening during the night time. The opening abnormal mouth opening mostly occur in night time, and that leads to the structural and functional alternation of the neck also, which alters the middle ear pressure. There will be changes in the middle ear pressure due to the structural and functional alteration of the neck. That will lead to tinnitus, stiffness in ear, and loss of hearing. All these three symptoms together called as Costed syndrome. Next, moving to the sino-nasal symptoms. Nasal pathology are the most common occur in smokers when compared with the non-smokers. As smoking is the main cause of COPD, the patient with COPD have many diseases which affect the nose as a comorbidity, like rhinitis, nasal inflammations, nasal obstruction, and sinusitis. All these symptoms are persist after smoke cessation also. If we are discontinuing the smoking, then also there will be these symptoms. These symptoms will persist. And loss of normal conditioning function of the nose will allow the unfiltered, cold, and dry air to reach the bronchi. It causes the inflammatory stimulus to the nasal mucosa, which will result in airway inflammations. And there is homing of the inflammatory cells to the entire airway. And for a chronic rhinitis patient, there will be post-nasal drip. Through these post-nasal drip, the inflammatory cells are means will cause the colonization in lower respiratory tract area also. So from upper respiratory tract, the infection will move to the lower respiratory tract, and there will be a chance of occurring COPD. That means from nasal symptoms, there will be chance of getting COPD, and also for a chronic obstructive disease, there will be a chance of getting rhinitis and all these nasal inflammation, nasal obstruction, sinusitis also. Nasal blockage lead to the blockage of sinus opening also. Long-term blockage leads to the sinusitis and nasal polyps. In chronic COPD patients, there is a chance of epistaxis as a post-operative complication after bypass surgeries. If the COPD patient is with any of the heart complaints, if they want to undergo a surgery, there is a chance of nose bleeding after the surgery. And also there is a chance of thinning of nasal mucosa after a long-term usage of nebulizers in COPD patients, and also that will lead to a small amount of epistaxis. Next, move to the laryngopharyngeal symptoms. COPD patients have a higher degree of hoarseness, throat clearing, excessive throat mucus, cough, and sticking sensation in the throat, because there will be more production of the mucus in that. So laryngopharyngeal reflux are more prevalent. This will call pharyngitis. COPD patients have a chance of getting dysphagia and always associated with the shortness of breath and fatigue, which disturbs the apneic period. Apneic period means the airway closing during the swallowing time, and causes the aspiration of food or liquid to trachea, and that will cause aspirational pneumonia. There is a chance of developing aspirational pneumonia for these chronic obstructive pulmonary disease patients. Then we are moving to the treatment. Nidana Parivarjana is the main treatment. Main treatment you have to do Nidana Parivarjana. That means cigarette smoking and exposure to smoke and dust are the main Nidanas for COPD. So we have to avoid the cigarette smoking or exposure to dust and smoke, etc. Next, move to the Shodhana. Shodhana means if the collected mucus are there in the airways, throughout the airways, from nasal mucosa to uh, bronchioles and alveolus. So we have to by doing Shodhana procedure, we have to expel the extra collected mucus from all these airways. And next move to after the Shodhana procedure, we have to move for Shamana procedure. That means we have to for subsidation of the symptoms, we have to do some more treatment. That are the main treatment tell in Ayurveda Samhitas. But in the case of allopathy, they are doing some inhalers, giving some inhalers uh, for the dilatation of the bronchioles and also alveolar for a normal functioning of the body. And also they are giving some anti-allergic drugs or analgesics for the pain and for allergic symptoms. First, we are moving to the Nidana Parivarjana. First, we have to find out the causative factor. What all are the causes of COPD in individuals, such as to stop smoking, taking appropriate precaution of certain types of occupational environment. If the patient is working in smoky areas or dusty areas, they have to use proper precaution from that all things. That means wearing a mask or wearing some protective measures against all those things, and avoiding close contact with people suffering from respiratory infection. If these COPD patients are having very less immune response, if they are exposed to uh, other respiratory infections, they have a chance of getting more infections, means sudden infection from those people. So these people uh, have to take some protective measure to or they have to avoid the contact with the people who are suffering from the respiratory infections. And they also have to avoid the exposure of excessive heat and cold and high altitude. Uh, it also causes some changes in the pressure also, and also in high altitude there is we have high altitudes the pressure will be low, though we are unable to exhale or inhale. So we have to avoid, means the COPD patient have to avoid the high altitudes and excessive heat and cold exposure. uh, Exposure to environmental irritants also we have to avoid, because the irritant cause some extra secretion or hyper secretion of the mucus inside the airways, though the COPD patients are more prone to that hyper secretion. So there will be narrowing of the airway will be there. So we have to avoid the exposure of environmental irritants, and also we have to avoid the day sleep. Actually, the day sleep will increase the kapha, that means the mucus inside the airway canal, and also that will cause another obstruction to already narrowed air cells. So means airways. So we have to avoid the day sleep also. And move to the modification in lifestyle. Exercising regularly. We have to take a regular exercise as told by Acharyas, and taking a fresh, warm diet which is low in saturated fat but rich in fruit, vegetables, and whole grain foods, and maintain a normal weight to be in well ventilated, hygienic environment. We have to take more vegetables and fruit, and also avoid to take more fatty foods. If we are getting fat, there is also chance of accumulation of the fat inside the bloodstream also, that also causes the lower oxygen level in blood vessels also, that also increase the chances of less oxygen in blood. So we have to avoid the fatty foods, and include more fruits and vegetables in your diet, and always take a warm and hygienic food. And exercise regularly. And we have to sit in a ventilated area, ventilated hygienic area for getting more good amount of oxygen. And next we are moving to the nasya. Nasya, we have to do it Pratimasha and Masha type. If the patient is in episodic, means in episode, that the patient feels asthma or any irritations, then go for only Pratimasha Nasya, only 2 drops Anutaila or Shadbuntaila we can used in each nostril, that maybe prevent coming in contact with the irritant or pollutant uh, which present in nasal mucosa. If some irritant is present in atmosphere, if we are rubbing the nasal area with Anutaila or Shadbindu Taila, that may protect the nasal mucosa from all that pollutants. And next move to the walking up early in morning at regular time, and taking glass of warm water early morning in empty stomach, and avoiding irregular and untimely eating of food may help in prevent complication of COPD. Means all these procedures are comes under Amapajana. In the early morning time, there will be accumulation of kapha. If we are consuming more hot water, or we are doing a proper walking, there will be the amapajana procedure will be there. And there will be uh, means the henna process will be good will be good by doing all those things. And next moving to the use of Rasapradhana Aushadas, use of Kadu, Lemana Ushna, Snigdha Lehu Ahara, and vegetables including gourd, bottle gourd, spinach, methi, garlic, ginger, caravela, padola, shigru, and pulses like mugda dal, pulatha should be encouraged in patients of COPD, because all these food items are lekhu in quality, and which is sikda and ushna, and also kadu properties there. So there will be amapajana will be there, and that also reduces the kapha, and will produce immunity. Means all are good healthy product which gives immunity to the patient to fight against the diseases. And next moving to the uh, food items also. Excessive use of means contraindicated foods. Excessive use of tomato, cauliflower, potatoes, and preparation of rice flour, sweet, curd, whole milk, black gram, coconut oil, fermented and sour food articles, and cold drinks. Refrigerated foods articles, etc., shall be avoided in daily diet, because there will be the production of means more excessive production of kapha, and also that may be lead to the excessive uh, production of the fat also in the body. So we have to avoid all those things which is sweet in quality, which is cold, and which causes more medaja, means which increases the meda. So we have to avoid all those things. Next, moving to the Shodhana procedure. Timely and seasonal Shodhana. If the patient is normal or he is strong, we have to do seasonal Shodhana procedure as said by the Acharyas. We have to move for Vamana and Virajana procedure, and Niruhavasti for a strong person. If the person is not strong, then we have to go for Pradhimashanasya and for Anuvasanavasti and all. and Vasnavasti and all. Okay. These type of therapies alleviate the kapha and may dry up the excess mucus secretion in the pranavaka srotas. For the clarity in pranavaka srotas, we have to do all these procedures. Next, move to the Shamana procedures. Single drug we have to use is Adraka, Ela, Haridra, Trikadu, Pippali, Ashwagandha, Aktimanda, Ajamoda, Ajaji, Guduji, Ativisha, Aragvada, Karankabija, Daru Haridra, Leshina, Rasona, Hindu. All these drugs, single drugs we have to use because all these are amapajna property that increase the digestive power and also help in reducing kapha. Preparations like Kapagedresa, Gojihwadikwada, Dashamulakwada, Chitraki, Haridagi Avaleha, Tamrapasma, Mahalakshmi Vilasarasa, Lokantarasa, Roshadi Churna, Sarpiguda, Shigruadi Churna, Haritaki Modaka, Pipalyadi Gudiga, Sitopaladi Churna, Talisadi Churna, Vyakra Haridaki Lega. All these preparations we have to use according to the condition. And COPD is a chronic disease. That's why the usage of rasayana is important in this type of diseases. By the usage of Pippali Rasayana, Chavanapasha, Agastya Haritagi, Vyatri Haradi, Haridra Khanda, Ashwagandha, Guduji, etc. also helpful in reducing COPD. Next, move to the Yogasana and Pranayama. Pranayama, mainly important pranayama is Kabalabhati, which will increase the which increase the oxidation inside the blood vessels also, and also clears the kapha. So daily practice of Kabalabhati will reduce the chance of getting COPD. Logas like Bhujangasana, Shavasana, Shalabhasana are useful asanas for pranavaka srotas, and it accelerates the blood circulation of the lungs and thus increases the vital capacity of the lung. It also increases the vital capacity of the lung. Let's move to the ENT diseases and their treatments. Constant syndrome means the ear symptoms. For that, TMJ joint is the most affected joint. So there will be Pindos ligament will be there, that is stretched during the night time due to the over opening of the mouth during night time. So we have to move for a Abhyanga Seda procedure, which will alleviate the stretchability of the Pindos ligament and helps in the help with the reduction of the diseases. Next, move to the Nasya Karma. If you are doing the Nasya Karma, Nasya Karma is very important in Urthayatrigata Vigaras. If you are doing a Nasya Karma, that also elevate the stretch in Pindos ligament. Steam inhalation also helps in elevating the stress in Pindos ligament. Labor in that area, which will reduce the pain in that area. Hanuvasti will helps in reduction in the stiffness of that area. Gendusha with Vata Kapha drugs are indicated. Gendusha also strengthens the maxillary and mandibular region, which also helps in reduction of the ear symptoms. And practicing pranayama and asanas like Simhasana also indicated in Constant syndrome. By all this procedure, we have to improve the ear symptoms and ear. Next, move to the sinonasal diseases. All sinonasal diseases are associated with the blockage. First, we have to do means Kapha Dushtikara Vigaras are there. So we have to do Tibana Pajana drugs, and as it is a chronic disease, we have to do Rasayana therapy by early mentioned drugs, and also Pradhivanshan Asya is very important in this condition because there is a blockage of sinus due to the long-lasting blockage of nose obstruction. So we have to do Mashanasya or Pradhimashanasya according to the condition. Swedana also very beneficial in that time because there is blockage. Swedana always correct the blockage. Local labana, if there is pain in any areas means sinal areas, we have to apply local lebanas. Neti also have to remove the blockage through the over accumulation of the mucus in nose. So we have to do neti. Pranayama also improves the entry and exit of the air. So we have to do pranayama. Next, move to the laryngopharyngeal diseases, the Vinabhadana drugs, because all the diseases are coming from the Agni Dushti. So we have to do the Vinabhadana treatment and Kabahara Chikitsa also, because Urthajitra Vigaras are always coming from the Kabadushti. So Kabahara Chikitsa is we have to done, and in the patient with the laryngopharyngeal disease, they always have a swarakna, hoarseness of sound will be there. So we have to use some swarakna chikitsa, means improving the swara chikitsa we have to do. Talisapatradichurnam, Sidobaladichurnam, etc. are very helpful in improving the swara. And Ushna Udakapana also help in alleviating kapha. Elevating kapha during early morning time. Consumption of Ushnodaka at early morning time will elevate the kapha in Urtajatru. And Kavala means for elevation of kapha, we have to use Kavala and Gandusha. Pranayama also we have to practice. Let's move to the conclusion. All the diseases explained here are the comorbid condition of COPD and also are the primary causative factors of COPD. So proper history taking is very important in treating these kind of diseases. The patient is with history of COPD. All those symptoms may be comorbid condition, and if the patient has any of the above said symptoms and not doing a proper treatment for that, there is a chance of getting COPD later. And the important thing which keep in mind that the proper following of Ritucharya, Dinacharya helps the human to stay healthy, improves his immunity, gives strength to protect against the diseases. Avoid all life-threatening habits like cigarette smoking, tobacco chewing, etc. Early diagnosis of proper treatment disease, a healthy food habit, proper exercise, practicing pranayama will help to prevent the disease. And COPD is being a chronic progressive disease with irreversible changes need to early diagnosis and proper management. And extra care of diet pattern modification and lifestyle modification will judicious to use of rasayana can play major in the prevention of or progression of the COPD. Thank you.
Thank you, madam.
Thank you, sir.
This is a wonderful session you have conducted. Though I agreed it is related to upper respiratory tract infection, but still it's have some significant regarding to more exacerbations towards the lower respiratory tract infection and COPD. You explained it very well. If there is any query, you can ask here. Feel free to directly ask.
Anu, tell me, how will you justify Pratishayat Bhavet Kasat Sanjayate Kshayaha?
Ma'am, actually I didn't get you.
How will you justify that Pratishayat Bhavet Kasat Sanjayate Kshayaha? According to
Pratishayat
me,
Actually,
Sanjayat.
it's related with
uh,
ear, nose, and throat, and especially nose when it comes to COPD.
Yes, ma'am. If you are not properly treating the rhinitis or nasal symptoms before, it will lead to another complication like Kapha and Chaya. That means the COPD only. If we are not treating the rhinitis first, we are not doing the proper treatment, that will progressive to COPD disease, like means obstructive disease like Shaya.
How will you justify the importance of Pratimarshanasya in Dinacharya to stop or to avoid the COPD?
If we are properly doing Pradimashanasya, there will be means that will help the human being from entering. I means the microbes are will enter in first enter in our nose. If we are doing it properly, then we will got the immunity to protect means fight against those microbes, and there will be they are more immune to those microbes.
Madam, recently in COVID regarding infection, we have suggested many of our patients that Pratimarsanasya should be there, and that application of Tila in nostrils will definitely, what we say, obstruct and adhere some infection partially or fully for COVID related infections. So, madam question is very valid, and your answer is also okay. Yes, anyone queries, please? Hello, Anu madam.
Yes, sir.
Okay. If there is upper respiratory tract infection and that person is having vigorous exercises, does it goes downwards to create COPD?
If he is doing vigorous exercise, there will be production of more mucus, and also there will be a chance of postnasal drip that may go down to the means lower respiratory tract. There will be more chance of colonization of microbes there. So there is a chance, sir.
Okay. So, if a patient is having upper respiratory tract infection, do we advise him for any kind of pranayama or kapalbhati or something vigorous, forceful breathing exercises?
During first stage means not advocated, sir.
It is not allowed. That's so good. So this is all regarding the upper respiratory tract related COPD and its ENT role. Thank you everyone. We are concluding these sessions. Thank you, ma'am.
Thank you, sir.